Welcome to Podcast Summaries, where every week we break down powerful ideas from 8 to 10 top podcasts to help you grow, heal, and thrive while saving time. If you find this summary helpful, please subscribe and check out links for more content. Your support keeps this journey going. Here is a summarized version of Noon Herbal Medicine Expert. This over-the-counter drug is quietly killing you, featuring Simon Mills by Stephen Bartlett. Stephen Bartlett asks if there are alternatives to consider as a form of medicine, and Simon Mills responds by sharing some of his favorite herbal remedies. He explains that most of these remedies have a pretty immediate effect, and he invites Stephen to try some of them. Simon shares his expertise on various herbs, including garlic, which is used in some parts of the world instead of penicillin, and rosemary, which has been shown to have a positive impact on brain health. Simon Mills has spent over 50 years working with plants as a form of medicine, and he's seen thousands of patients in his career. He's worked with a wide range of illnesses and conditions, from cancer to chronic inflammatory diseases, and he's developed a unique approach to treating his patients. Simon explains that he's not just interested in treating the symptoms of a disease, but rather in understanding the underlying causes of the condition and addressing those. Simon shares a remarkable case study of a patient named Heather, who had a severe skin disease called erythema multiforme. He worked with Heather to identify the underlying causes of her condition, including a vitamin B12 deficiency and lung damage, and he developed a treatment plan that included a combination of herbal remedies. Within a week, Heather's symptoms began to subside, and over the course of several months, her skin problem disappeared. Simon also shares the story of a patient named Karen, who was experiencing panic attacks and anxiety. He discovered that Karen had a history of liver problems, including jaundice, and he developed a treatment plan that focused on supporting her liver health. Simon explains that the liver is a critical organ that plays a key role in processing emotions, and he believes that by supporting liver health, he can help his patients manage anxiety and other mental health conditions. Simon's approach to medicine is holistic and focused on empowering his patients to take control of their own health. He believes that by working with plants and other natural remedies, he can help his patients achieve a deeper level of healing and wellness. As he says, "Let food be thy medicine," and he encourages his patients to think of food and plants as a source of healing and nourishment, rather than just as a way to treat symptoms. Stephen Bartlett wants to dive deeper into the concept of women's herbs and their connection to fertility and menstrual cycles. He's particularly interested in understanding how herbal medicine can address issues like PCOS. Simon Mills explains that when it comes to women's health, herbal medicine often focuses on supporting the body's natural hormonal balance. He shares an example of a patient, Kara, who was struggling with anxiety, sugar cravings, and menstrual irregularities. By using a combination of herbs like milk thistle, barberry, and gymnema, Simon was able to help Kara manage her symptoms and regulate her menstrual cycle. Stephen Bartlett asks Simon to elaborate on the importance of the stomach and gut in understanding herbal medicine. Simon explains that the gut is a complex system that's often overlooked, but it plays a crucial role in our overall health. He notes that the gut is home to trillions of microorganisms, which outnumber our own cells, and that these microorganisms are responsible for many of our bodily functions. Simon emphasizes that the gut is not just a passive tube, but an active, intelligent system that's constantly making decisions about what to absorb and what to eliminate. Stephen Bartlett asks Simon about the risks of antibiotic overuse and how it affects the gut microbiome. Simon explains that antibiotics can have a devastating impact on the gut, killing off both good and bad bacteria, and leading to a loss of biodiversity. He notes that this can have serious consequences, including an increased risk of infections, autoimmune diseases, and even cancer. Simon emphasizes that antibiotics should only be used when absolutely necessary, and that there are often alternative, natural approaches that can be just as effective. Stephen Bartlett asks Simon about the alternatives to antibiotics, and Simon shares an example of using ginger and cinnamon to treat a cold. He explains that ginger has natural anti-inflammatory properties and can help to stimulate the body's natural healing processes. Simon also notes that cinnamon has a complementary effect, helping to warm the body and stimulate blood flow. He shares a simple recipe for making a ginger and cinnamon tea, which can be used to treat a range of conditions, from colds to menstrual cramps. Stephen Bartlett asks Simon about the importance of heat in treating certain conditions, and Simon explains that ginger and cinnamon are often used to treat conditions that respond to heat, such as colds, headaches, and menstrual cramps. However, he notes that some conditions may require cooling remedies instead, and that it's essential to understand the individual's needs and preferences when using herbal medicine. Stephen Bartlett asks Simon Mills about herbal teas, and Simon suggests starting with them because they're a low dose and can help figure out what suits you. He explains that old medicines were divided into warming and cooling remedies, and that herbal teas can be used to determine which type you prefer. He explains that bitters, such as wormwood and dandelion, were used to stimulate appetite and improve digestion. Simon Mills explains that bitters work by triggering taste buds in the mouth, which produces hormones that stimulate digestive activity and increase blood flow to the digestive system. He notes that bitters were used to manage fever and improve digestion, and that they can be used to help with appetite and digestion. Simon also mentions that garlic has antimicrobial properties and can be used to help with gut health and as a prebiotic. Stephen Bartlett asks Simon about vitamin D and vitamin C as potential alternatives to antibiotics, and Simon notes that while they're not a direct alternative, they can help improve natural resistance to infections. Simon Mills explains that chronic pain is often caused by inflammation, and that plants can be used to help reduce inflammation and pain. He notes that this is an example of using plants in a creative way to address pain, and that it's something that people have been doing for centuries. Simon also mentions that he's seen this approach work in his practice, and that it's something that people can try at home. Stephen Bartlett asks Simon about low back pain, and Simon notes that he's experienced it himself. Simon also mentions that ibuprofen is a widely used drug that can help reduce pain and inflammation, but notes that it's not a long-term solution and can have negative side effects. Stephen Bartlett asks a follow-up question about inflammation, wondering why it's necessary. Simon Mills explains that inflammation is a defense mechanism, one of the body's most powerful defenses. He notes that when someone reaches for ibuprofen, he asks what can be done to reduce the need for inflammation in the first place. He suggests that addressing the root cause of inflammation, such as metabolic strain or poor diet, can be more effective than simply suppressing it. Simon Mills uses the analogy of a military operation to describe how inflammation works. He likens white blood cells to Marines who are deployed to attack and eliminate foreign invaders. Inflammation is the process of bringing in more of these Marines to finish the job. However, if the problem persists, the Marines can become the problem themselves, leading to chronic inflammation. Stephen Bartlett shares a personal experience with inflammation, having injured his ankle and received conflicting advice on how to manage it. Simon Mills advises that in cases of acute inflammation, it's generally best not to suppress it, as it's a natural defense mechanism. However, in cases of chronic inflammation, it may be necessary to intervene. Simon Mills emphasizes the importance of addressing the root cause of inflammation, which often lies in the gut. He notes that the gut is where most foreign material enters the body, and that a healthy gut microbiome is essential for immune function. He also notes that many vegetables were originally purple, but were bred to be less colorful over time. Simon Mills discusses the importance of eating a rainbow of colors to support the microbiome and overall health. He notes that artificial dyes in junk food can be misleading, as they don't provide the same benefits as natural colors. Stephen Bartlett asks about Simon Mills' diet, and he reveals that he eats a broad range of foods, including plants and animal products. He notes that there is no one-size-fits-all approach to diet, and that different people may thrive on different types of food. Simon Mills discusses the keto diet, which Stephen Bartlett is currently following. He notes that while the keto diet can be beneficial for some people, particularly those with insulin resistance, it may not be suitable for everyone. He also notes that a diet low in sugar and high in fat can be beneficial for fertility and menstrual health. Simon Mills notes that insulin resistance is a common underlying factor in PCOS, and that reducing sugar intake can help regulate menstrual cycles and improve fertility. Simon Mills prescribes herbal remedies to women with fertility and menstrual problems, including echinacea, which he notes has a powerful effect on the body. He also notes that some herbal remedies can interact with hormone mechanisms and help regulate menstrual cycles. Stephen Bartlett wants to know who should be thinking about using echinacea that way. Simon Mills explains that anyone with an upper respiratory problem should consider it, especially if they want to experience the unique tingling sensation that echinacea is known for. This sensation is a sign that the herb is working to activate the white blood cells in the body, which can help to fight off infections. Simon notes that echinacea can be used in various forms, including pills and tablets, but the tingling sensation is most pronounced when it's consumed in a liquid form. Simon Mills goes on to explain that echinacea is particularly useful for infections that affect the upper respiratory system, such as sinus problems, middle ear infections, and throat issues. He also mentions that echinacea can be used to support the health of the gut microbiome, which is closely linked to the health of the upper respiratory system. Stephen Bartlett asks Simon about the use of water fasts as a form of medicine. Simon responds by saying that while fasting can be beneficial, it's not suitable for everyone, particularly those with certain health conditions or who are malnourished. Simon Mills shares that about a third of his patients are living with cancer, and that he uses herbal remedies to help them manage their symptoms and improve their quality of life. He notes that while herbal remedies can't cure cancer, they can help to reduce the risk of developing the disease and alleviate some of the side effects of conventional cancer treatments. Stephen Bartlett asks Simon about the role of diet in cancer prevention. Simon responds by saying that a poor diet is a major risk factor for cancer, and that eating a balanced diet that is rich in fruits, vegetables, and whole grains can help to reduce the risk of developing the disease. He also notes that certain foods, such as processed meats, have been linked to an increased risk of cancer. Stephen Bartlett asks Simon about the use of herbs to support cardiovascular health. He also notes that spices, such as ginger and cinnamon, can help to reduce inflammation and improve cardiovascular health. Simon Mills explains that turmeric, which contains a compound called curcumin, has potent anti-inflammatory and antioxidant properties. He notes that while curcumin is not easily absorbed into the bloodstream, it can still have a positive effect on the body by supporting the health of the gut microbiome. Stephen Bartlett asks Simon about the use of green tea to support brain health. Simon explains that green tea contains a number of polyphenols, which have been shown to have a positive effect on the brain and may help to reduce the risk of dementia and cognitive decline. He notes that regular consumption of green tea has been linked to improved cognitive function and a reduced risk of age-related cognitive decline. Simon Mills also mentions the use of rosemary to support brain health. He notes that rosemary contains volatile oils that can be inhaled and absorbed into the brain, where they may help to improve cognitive function and memory. He also mentions that ginkgo biloba, a herbal remedy that is commonly used to support cardiovascular health, may also have a positive effect on brain health. Stephen Bartlett is sipping on a cup of green tea, flavored with a hint of mint, and he's excited to dive into the world of herbal medicine with Simon Mills. Simon Mills is a renowned expert in the field, and he's here to share his knowledge on the benefits of green tea, dark chocolate, and other plant-based remedies. Simon Mills explains that green tea is rich in polyphenols, which have been linked to numerous health benefits, including heart and brain health, fat loss, and cancer prevention. He notes that the key is to consume high-quality green tea, with minimal added sugars and flavoring. The conversation turns to dark chocolate, which Simon Mills describes as a medicine in its own right. Stephen Bartlett shares a personal anecdote about learning to make chocolate in Peru and being shocked by the amount of sugar that goes into white chocolate. Simon Mills explains that cholesterol is not always the villain it's made out to be. While high cholesterol can be a risk factor for cardiovascular disease, it's also essential for brain function and hormone production. He notes that a plant-based diet, exercise, and stress management can all help to keep cholesterol levels in check. The conversation takes a surprising turn when Simon Mills mentions omeprazole, a widely prescribed medication for acid reflux. He notes that while omeprazole can provide quick relief, it can also have serious long-term side effects, including an increased risk of cancer and dementia. Simon Mills emphasizes the importance of treating plants with respect and care, noting that many modern farming practices can damage the natural balance of the environment. As the conversation comes to a close, Simon Mills leaves a question for the next guest. How do you keep up with the rapidly changing world? He reflects on the importance of reconnecting with loved ones and the natural world, citing his own experiences as a grandfather and a practitioner of herbal medicine. Stephen Bartlett wants to know what resources are available for listeners who want to dive deeper into the world of herbs. Simon Mills points to his website, which links to a wealth of information, including the Herbal Reality Resource, a treasure trove of knowledge on using plants. Simon's enthusiasm is palpable as he encourages listeners to explore these resources, and Stephen Bartlett is clearly a fan of Simon's work, thanking him for being a champion for nature and humanity. The conversation takes a brief detour as Stephen Bartlett takes a moment to thank his listeners and encourage them to subscribe to the show, promising to continue delivering high-quality content and listening to their feedback. Thank you for tuning in. Please subscribe. Check out YouTube channel and just remember, subscription is only £1 or $1 per month. Leave a comment or review. Until next time, happy listening.